The Civil Society for Eradication of Tuberculosis in Nigeria has organized a comprehensive two-day training to relevant stakeholders in Kano State, focusing on effective drug-resistant treatment and community-led monitoring. In her remarks, Cecilia Capran from TB Network said the objective of the project is to coordinate efforts to ensure all DRTB patients receive comprehensive support throughout their treatment journey in Kano State.
The project is being implemented here to ensure that all patients on treatment for DRTB are given that support that they need around treatment to ensure that the new regimen, which is called BPALM, they accept, continue the treatment, and complete it. So this program has brought together stakeholders who are providing such support, starting from the state level, the local government, the health facility, people in the community, even religious leaders who, can support one way or another. And partners are also here. We all work together to ensure that the TB program and control efforts are well coordinated and we can achieve better results than before. So ultimately, what we want to see is that all the DRTB patients are supported so we can achieve that 100% cure, at least for all the patients that are on treatment.
Beyond this training or beyond this number of people you train here, what are the indicators that your organization are using to measure the progress or the goal of making Nigeria free from TB?
Nationwide, all the state TB programs work together to ensure that we all achieve the same aim. And that is why the strategy comes from the national level. It's adopted here in Kano, and every other players or stakeholders, we are all keen into that strategy to ensure we are achieving the results we are looking for.
In his remarks, the facilitator, Chiku Ibuka from Civil Society for the Eradication of Tuberculosis in Nigeria, said this approach represents a fundamental shift toward patient-centered care.
Community-led monitoring is an approach that empowers the affected communities to be able to monitor the service delivery and service provision in their communities, and also utilize those information to improve the general services entirely. The approach aims to track service availability, acceptability, accessibility, and quality of those healthcare services. In this context, it's going to be TB and DRTB services, and also looking at the stigma-related discrimination and human rights-related issues and barriers that are stopping people from accessing services. These issues, when identified, are going to inform advocacy within the community. And through that advocacy, individuals will be engaged to be able to address all these issues that are stopping people from accessing TB, DRTB services, and also help improve the general TB program starting from Kano State and extending towards the entire country, Nigeria.
In his statement, Dr. Sulaiman Musa Kopa, Program Officer from TB, Leprosy and Bully, also in Kano State Ministry of Health, highlighted critical obstacle of patient tracking. Dr. Kopa, on behalf of the Honorable Commissioner of Health, Dr. Abubakar Labaran Yusuf, officially announced the guarantee of medication availability of TB and leprosy in the state.
Currently there is a global cut down in funding, and even as at that, you see the National Tuberculosis Program, in collaboration with the states tuberculosis program, are actually doing everything possible to see how we can work together to tackle this menace. Because I call it menace, because a situation whereby a particular patient is diagnosed for TB and then there are no medications to place those particular patients that have been diagnosed on TB medications. So that one is a major problem. So, and I think, as I speak to you now, in Kano State, there is TB medication in our DME. So that is to say, all patients diagnosed have a high chances of being placed on anti-TB medications.
The training bring together community-based organizations, TB survivors, health workers, healthcare providers, and partners to fast-track patient cure rate and ensure complete treatment support. It has been Aisha J. Ahmad reporting for Post Time Nigeria.